It is just my special honor to be able to introduce our conference keynote speaker tonight. Dr. Joseph Coughlin is the founder and director of the Massachusetts Institute of Technology AgeLab research program that was created to understand the behavior of the 45-plus population, the role of technology, and the opportunity for innovations to improve the quality of life of older adults and their families. I'd like to give you just a glimpse of his accomplishments and the spheres of his influence. In 2008, the Wall Street Journal named him as one of America's top 12 pioneers, inventing the future of retirement, of how we will all live, work, and play tomorrow. And recently, the Visiting Nurse Association recognized him as a home health hero for his research in technology-enabled innovation in home health care services for the elderly. These are just two of the many, many spheres of his amazing influence from around the world. Over the past 8 years, I've had the privilege of hearing Joe's keynote words in many conferences, and they've always motivated me to think creatively about meaningful possibilities for my clients and the true potentials for occupational therapy, for expanding our profession as we look at the things he talks about. The research of the MIT AgeLab under Joe's leadership is greatly aligned with this year's conference theme of science, innovation, and evidence. As you will hear tonight, Joe will challenge us to think of our clients as ourselves, with desires and wishes and dreams to value excitement, spontaneity, and health as a profession whose core value is to help clients do what they want and need to do. In my work, I do see transportation as a critical thread to access and participation, and Joe will highlight how this thread is life's connector. At the American Society on Aging conference several years ago, Joe ended his presentation with a photo of an ice cream cone. And then recently, a group of us laughed as we kind of admitted to borrowing his wise example when ending some of our talks. Because you see, an ice cream cone represents a spontaneous wish to access something meaningful to us at that moment on that day. And that's Joe's challenge to us, to think about our clients' access to life's spontaneous pleasures and listen to the consumer's demand for it. How important it is to be an advocate for change so all persons of all abilities have the means, the health, and the transportation to do the things that they want to do when they want to do them. So now it's my great pleasure to introduce our inspiring and thought-provoking keynote speaker, Dr. Joseph Coughlin.
Good evening. Oh, come on, I know you're a very low-key group. Good evening. Now, I go to a Jimmy Buffett concert every year. I think this one may outpace what goes on in the parking lot. So, by the way, that was a great intro. There's a fine line between a eulogy and an intro, but Aylin, thank you very much. You should know that your colleague, Aylin Scholl Davis, is probably one of the most powerful, passionate, and knowledgeable agenda setters in the older driver debate in the United States that has gone on for decades, and Aylin has moved that ball forward. I'd like to thank all of you and your leadership for having me here for the next few minutes. I'm hoping to put a challenge ahead of you because I believe you are the profession that will help me live better, especially this quarter of the room here. I'm really looking forward to staying active because you're going to help me stay active. I want to talk to you a little bit about aging. Now, usually many people make that into a dour discussion, but I want to redefine it for you. Have you ever thought of what the alternative to aging is? Not nearly as pretty. Aging is about life tomorrow. Ladies and gentlemen, mostly ladies I know, I want you to help me, all of us, invent life tomorrow. My students created this little graphic. It shows you can ruin a perfectly good piece of art for $75. I usually do that just so I'm not the only one with the same haircut in the room. Let me give you a kind of insight as to what we're looking at. Imagine this kind of forecast from a doctor. Only 106 years to live. Let me give you a number to think about. You don't often think in terms of the following. The Lancet, 2 years ago or thereabouts, published an article that said half of the children born today in the so-called rich world will live to 100. Think about that. Now, yes, that's Europe, North America, lots of other places being left out, but we are now looking at this as a relatively frequent birthday cake in the near future. Let me ask you just a very quick question. Class participation is 10%. What was life expectancy about 100 years ago? 60, wishful thinking. About 47, 45, 48, depending where you were. That means I should have been dead 2 years ago, frankly. But the fact is, now that we're living upwards of 30 to 40 years longer than our great-grandparents or, frankly, any other generation. 100 is more than just living longer. Here's the challenge for all of us. What are you going to do? And so that's what inspired me in terms of listening to a woman. This is Sarah Noss from Pennsylvania. This is Sarah Noss at 119th birthday. Now, I want you to imagine somebody, and the only way I can put this is a journalist had the chutzpah to ask Ms. Noss the following: why do you enjoy living so long? Can you imagine? But you know something? She answered far more clearly and with great articulation, more than an academic, policymaker, clinician, or anyone else. She said, I have my health and I can do things. Ladies and gentlemen, that's my charge to you. I want you to help me reinvent what health and what doing things will be in that additional 30 to 40 years. To reinvent aging as an opportunity and a call to innovate, and not just a challenge of what aging has always been defined as before. That is the paradox. The paradox is that humankind's greatest contribution is an additional 30 to 40 years of life, and it has never made the newspapers, only in the sidelines as something dour and sad to think about. Together, I believe your profession can make this something to seize as a way of living life better, longer tomorrow. So we might as well get this out of the way. This is the noisiest generation. Those of you born between 1946 and 64, please raise your hands. Yes, these are the baby boomers. In the words of the great philosopher Jimmy Buffett, these are the people your parents warned you about. And these are the people that are aging, turning 66, roughly 1 every 7 seconds. Now keep in mind, that means that in 20 years, the entire country will have the profile of the state of Florida. That's got all kinds of implications for older drivers, but we'll talk about that a little later on. And they're a different kind of group. Not only are they numerous and loud and demanding, I want you to think about the mathematics behind this. 64% of people over 45 believe they have an above average IQ. Really? I've been in a number of faculty meetings where I'd question that, but that's a whole other issue. They have a great deal of confidence in themselves. But what I'm showing you here is that this is a new generation of old that is really going to chart higher expectations. And frankly, that's the difference of the next generation of older adults. I know that the younger folks are tired of hearing about the boomers. The older folks would wish we just shut up. But the fact of the matter is, the real next generation difference is that our parents and grandparents aged politely. And what I mean by that is that as they aged, we even gave it cute names. We had senior moments. If a knee hurt, you took a pill and you sat quietly. In fact, they even gave you a rocking chair. Now, I'm not saying that the slope line that baby boomers believe they're going to get out of this alive, but they do believe there's going to be a pill, a service, a solution, or an entire profession that is going to make living longer better. That gap of expectation between what our parents expected and the next generation and the several generations after as to how living longer better can be is the opportunity to innovate for new technologies, new services, and thinking creatively about how to spend that additional 30, 40 years of life. Very quickly, the difference will be the following. If my father went to a doctor for a bad knee at age 80, the doctor would say, gee, Frank, I'm sorry, you're 80 years old. Take your painkiller of choice. Thank you. Have a nice day. The difference will be when I am 80 years old, I will go to the doctor's office, and my wife will attend because she's tired of me whining about my knee. I will go in there, and the doctor, and I teach third-year Harvard med students, and trust me, it's much the same socialization. They will give me a better painkiller, and they'll say, gee, Joe, you're 80 years old, your knee hurts, good luck with that. My wife, upon hearing that, will push me out of the way and go to the doc and say, you know, gee, doc, that's an interesting thing. You're right, his knee is 80 years old, but guess what? You know, his other knee is also 80 years old. It doesn't hurt. Fix the knee. This is what we're facing. And it's more than that. This is a generation that is now setting a standard for all our kids and for those to follow. I had a student do a content analysis of Vogue magazine. Can you imagine an engineering student leafing through Vogue? Do you know that the age issue, when it was first issued, talked about age as anything above 35? Well, age now is defined by Vogue and many others as pearls and Levi's after age 90. And whether it's aspiration, realistic or not, people are now setting their sights on saying, I want to work, I want to travel, I want to do a number of things. And also the belief, if not the outright faith, that there will be medication or something to keep me active most or part of the time. There is now, shall we say, a market for folks and a profession to make me better as I go through longevity, not just when I am old. So let me give you some visions, or depending on your level of kindness, hallucinations as to what the future may hold. Now, I'm only touching on a few things, because remember Sarah Noss said she had her health and she can do things. And I'm going to touch on health because that's a natural thing we have to start with, perhaps. But there's all kinds of things I want you to really start thinking about. You know, we think about work, we think about transportation, we think about housing, and I will touch on those. But I really ask you to start thinking about things like lifetime learning, changing professions. What's the future of play? I don't know if the undergraduates here have gotten the memo or the grad students have gotten the memo, but somehow we're socialized to believe that after about age 16, and certainly after 21, play is no longer legal. And the fact of the matter is, play is what makes us creative. So there are a number of things that I won't show you today, but I want you to use your imagination, because frankly, you just got 4 decades. What do you want to do with it? And golf and beach walking may be fun for a week or two, but not for a lifetime. So let's go into this. Is this the future of health? I hope that's not the natural evolution. Now, growing up in Philadelphia, where I believe that scrapple, cheesesteaks, and tasty cakes are food groups, that might be a future. I'm not sure. I've got some good news and some bad news for you. You will be ill, but you won't be sick. That is, chronic disease, as all of us know, is a scourge on our population and around the world. That the chances are that 110 million Americans have one chronic disease, 60 million have 2, and 20 million win the lottery ticket of upwards of 4+ chronic conditions. But here's the challenge. It's not about whether I have diabetes and hypertension and those come together, that nice mix of metabolic X. The challenge will be, how can you help me manage it in such a way that it does not take me out of the game? So what we're looking for now is where disability rates actually may be staying the same, or declining, depending on whose data you're looking at, there's going to be a great demand for being able to stay well enough to be able to enjoy those additional years. And who's doing this? What are some of the visions as to what's coming out in terms of technology and new partners and things that you're going to be seeing in part of your world? Well, you know when America has a problem? America tends to go to the mall. Retailers are now looking at services as being a driver of more profit, if you will, than moving toilet paper and toothpaste. So for all of you that may go to Walgreens or live in Chicago, where headquarters is, Walgreens now has not only hired nurses and the like, they're delivering things to the home, and by the way, providing therapy at the home as well as equipment. So all of a sudden, a new partnership for OT may be through retailers as those become the places that particularly caregivers and the like go to for solutions. The little device that you may have seen up there with looks like somebody's touching glass. That is a device called Teleportec, and it makes it possible to have a conversation or a discussion on medicine, finance, anything else, high fidelity, where you can actually tell the joke and the timing won't be off due to the video transmission and the like. The fact is that retail is the new norm. Now here's a device that one of my students developed a few years ago. It's called a pill pen. Now, we all know taking your medication is something a lot of folks don't want to do for a variety of reasons. Sometimes they forget, cost, sometimes you just don't like the side effects, or, hey, I'm feeling better, why do I want to take it? So how do we motivate people? Anyone want to answer that? How do you get people to do what they want to do? I'll look to the leadership here. I heard money, fun, that's true. Well, this student we thought she was really sweet. We knew she was really smart. She had a dark side. She believed that guilt was a great motivator. Now, do you all remember the Tamagotchi pets years ago? That if you didn't play with them, they got, sicker? Well, I want you to imagine a pill pet, this pet, has a picture of your grandchild on it. And if you don't take your pills, the pet gets sicker, sicker, the picture of the grandchild begins to fade, dies. The next generation is even more insidious. Because I want to ask you, what is more powerful? By the way, the person who owns aging in the world is a 47 to 57-year-old daughter. What is more insidious? The daughter who calls you up and stops saying, hello, Dad, but only says, hi, did you take your pills? And then hangs up? Or the next generation device is going to be bunnies. And your grandchild gets a bunny, you get a bunny, and they're connected by radio frequency, pager technology. And if the kid doesn't do their homework or play soccer practice or do what they're supposed to do, and grandpa doesn't take their pills, the bunny gets it. And so soon, you get a phone call from a 12-year-old going, Grandpa, what happened to my bunny? Social networks, emotion, fun, and guilt. So yeah, that's a little bit about health I wanted to show you. But you know, one of the other things we take for granted that people want to do is stay home. We want to stay in our own homes. You know, despite all the discussions we heard for decades about moving to Arizona, moving to Florida, do you know that even when the economy was going like gangbusters, less than 9% of the population ever picked up and moved? By the time you're 50, your marriage, your mortgage, and your memories are in one place, generally you don't want to go. So how do I stay in the home that while I am aging, actually the home becomes an extreme environment from being able to reach and go upstairs and the like? The fact is that most of us want to age in place. And by the way, 70% of the population over age 50 live in suburban and rural areas where services such as OT services are going to be far more difficult to get. So we now have to start thinking about how we're going to provide that. But how about redesigning the house? So I don't want to build a new house because frankly, I don't want to move. But we've been working with architects and my researchers at MIT around NASA, not talking about how to redesign the house, but can you imagine a house where when you go to redesign it in your 40s and 50s, becomes a modular home? Essentially, you start to plug and play different devices, like this space station kitchen that you see here that's on the space station. You actually pick it up, put it in the kitchen, it has all the devices you need, and guess what? You can actually reach things, or you can actually sit down and cut vegetables, making the kitchen a place where mom can stay and live rather than having her have to move out. So, what are the new gee-whiz technologies that are already on the market and beyond the laboratory? I'll keep this clean since we're getting closer to dinner. Yes, we're going to be in your underwear. The underwear is going to be talking to your toaster, talking to your refrigerator, and talking to the grocery store. This particular set of underwear has got not just a wetness sensor, but a body temperature sensor, motion sensor, as well as the fact it can track you on the planet within any place within 5 meters of accuracy. We can talk later as to whether you want me to track you that close. The spoon was made by a colleague of mine on campus. It is now going commercial. It can measure the viscosity, the carbohydrate, and the calorie count of that basic food group known as chocolate brownies. And here's the bad part. Not only does it tell you what's in your mix, it uploads that information via the internet and tells either your call center of your doctor or nutritionist, or in my case, my wife, saying he's at it again. Anyone here been to Japan? Okay, we have a few. Anyone use a smart toilet in Japan? Let's keep this clean, guys. I'm talking about, and has anyone been attacked by a smart toilet? Now, I'm not talking about those toilets that do things that we don't have to talk about. I'm talking about, and we'll keep this in computer science language. It downloads from the user body temperature, weight, did you take your medication, nutrition information, and then uploads those data via the internet to manage, monitor, and motivate 60,000 homes in metropolitan Tokyo. And by the way, this toilet you're looking at, you see, this one's made by Panasonic, and Toto has one just like it. This one is connected to the largest grocery store chain in the UK, facilitating home delivery of the foods that, shall we say, your toilet thinks that you're missing. By the way, PlayStation, Connect, whatever it might be, these are no longer just toys to keep people busy sitting in their basements for endless hours. These are now going to be the unique platform for education, for health, and for engagement around exercise and the like, more than we've ever thought of before. And yes, the robots are among us, whether it's wheelchairs, this one we developed in the lab that can actually say, please take us to find Joe, and it will find Joe, or take me to the kitchen, it will take you there. My colleagues there, David Newman, is developing this spacesuit for the trip to Mars. And when you go to Mars, it's an 18-month trip, you lose 1% to 2% bone density per month. You leave at age 30, you come back a 75-year-old osteoporotic. So she's got to develop a spacesuit that keeps you strong, able to reach, reduces the chances of getting injured, and can monitor all your vitals. And I said, gee, That sounds like what mom should have in her extreme environment called her house. So we teamed her up with Carrie Betancourt there from Reebok, who does swimsuit design, and said, how can we start to take really cool engineering and make it something that somebody wants commercially to wear rather than a device that radiates old person walking, old person walking. In this case, you wear it underneath your clothes. Paro, one of my favorite devices developed by one of my colleagues, is a therapeutic seal. It has sensors throughout its body, its eyes, it recognizes your voice over time and your face. And it has now become a very successful intervention for Alzheimer's patients in Denmark, Italy, and Japan. What is the future of work? Well, retirement looks a lot like work. Most people want to stay out there. They want to stay in working so long that according to the AARP, 40% of those baby boomers that say they want to retire early, they want to retire early to do something else, but 40% of them report they want to work until they drop. So how are we going to do that? How are you going to help us do that? You know, I got some good news and bad news. Older workers are remarkably healthy because frankly, if you can get that long on the job, you've probably done a pretty good job about not getting hurt. The bad news is, however, if you do get hurt with all those chronic conditions, you're out for a very long time. So something that's right square in the center of your profession and next generation of professionals will be workforce performance and productivity. Companies are now starting to get the idea, and this is why I'm really excited about how OTs will define the future around aging. You have a unique, holistic, philosophical, and scientifically based approach to keeping us well and performing well. So Gallup and Healthways, you deserve it. Gallup and Healthways are doing 1,000 surveys per day for 25 years to ask people how they're doing. And it's more than, can you go upstairs? It's more than, how are you feeling today? It's the physical, it's the emotional. Do you have access to services? It's all those things. That very holistic definition of well-being and vitality and performance is what the new definition of aging will be, and how your profession can bring it to corporate America, business, and the homes around the country to keep us all living longer and better. So finally, let's get to the topic that Aylin highlighted and the very topic that got me into aging in the first place. I became a specialist, if you will, in older drivers. That's somewhere trapped between humor and horror, but we can go between there. Think about this little list. This is from a HMO in California. Top 4 fears, I like this. Being diagnosed with a fatal disease, that seems reasonable. Number 2, losing the ability to drive. How about 3, a spouse being diagnosed with a fatal disease? By the way, I'm going to jump my own slide because if you look below, this was from a focus group we did, a gentleman reported, you can always get another wife, but you can only get 1 driver's license. By the way, what is transportation? You know, I know that I highlighted health, I talked about work and staying in your own home, but I have to tell you something. I can give you a place where you will have great shelter, 3 meals a day, and health care. Anybody want to take it? It's called prison. Before you can do anything, you've got to get there first. Transportation, and transportation in the United States is defined as driving. With 70% of the population out where transit either serves poorly or not at all, it is the glue that holds all those big and little things that you call life together. So how do we do this? What's the philosophy? How can we push this forward? Well, in my lab, what we've looked at is, let's see if we can push the car a little bit further. So we've got a number of vehicles out on the road. These are 3 of them. We've got 6 altogether. They're about $1 million a piece with instrumentation, looking at physiological measures, eye metrics, performance behind the wheel. By the way, if you're ever in the Boston area or New Hampshire where we drive and you see these vehicles, go to the 2nd floor of the nearest building. But what we're looking at is high performance driving. I want you to envision not just the car. We're taking this type of work into homes and in workplaces and the like that will be able to detect how is that person performing. Are they stressed? Are they fatigued? Are they well? And then the environment will change in real time. So with respect to the car, temperature, light, vibration to remind you what's going on. The notion is, can we use technology and the environment that we work in to improve the performance and optimal performance of the user? So we're doing this in the driving. You're seeing this technology already going into Volvo, BMW, and you'll see various other pieces of this technology out on the market within 10 years. But by the way, driving may not be a lifetime choice. I want to introduce to you Agnes. This is the Age Gain Now empathy system that was developed by OTs, geriatricians, and engineers at MIT. And what we looked at was how could we create a suit that would give the user the empathy, if you will, of what it is to lose various functions and then be able to use that technique to improve retail stores, transit, buses, and the like. And the fact of the matter is that first we have to get transit to be where people want to go, and then we have to make it truly accessible and be able to use it 24/7, as what Ellen was referring to in the intro. My metric as to whether transportation really works is if it's July, it's an evening, I want a chocolate ice cream cone, I want to get up and get the ice cream cone. If I have to book it 24 hours in advance, 7 days in advance, that's not life. That's just a very, shall we say, liberally managed prison. Improve the driver, finally. So we're doing some work right now with teletherapy and tele-rehab and exercise in terms of how can we improve the fact that many of you may think that your new car has reduced visibility in the corners. No, the car's fine. Your neck has stopped turning. The back, that starts to go in your 20s and your 30s, the various functions. Can we start to have people take the philosophy that your profession, and I would argue your profession alone keeps and it has the ability to bring to everyone else the wellness and well-being around driver, whether it's the driver fit program or anything else. The idea is that it's mind, body, and soul to be able to stay in your home, maintain your health, work, have fun, and get around. So let me conclude with some thoughts for you. And I think that, as I said, the profession of OTs, the next generation OTs have got a great challenge ahead of them, but an amazing opportunity. And given, shall we say, the verve in this room, I think we've got a pretty good chance at making that happen. First thing is, acknowledge your key strategic assets as a profession. You've got knowledge and skills that need to get out there and get out there more than they are now. And by the way, I'm not talking about other clinical professions. I'm talking about going mainstream and getting the public to know about it. Getting the average, pardon the expression, average Joe out there to know that longevity and vitality is a lifelong pursuit. Not to call you after they're 72 years old and say, oh, by the way, something's broken. What have you been doing for the last 30 or 40 years? Also, have you ever thought about this? There is no profession out there, whether it's geriatrics or gerontology. I have to confess, as a gerontologist or a transportation gerontologist, we've fallen down on the job. We do not chart what to expect in that next 30 or 40 years of longer life. There's no one to say what to expect in our housing, what to expect in driving. There's no holistic, shall we say, map, if you will, to say what we have to plan for, let alone to tell our families what to plan for. Build partnerships. Did you see the retailers I pointed out to? Did you see the telecommunications companies and the electric companies that are wiring these toilets and light to internet companies or to internet services? The fact is that you should look at retailers, you should look at major corporations and consumer electronic companies as your new partners to extend not just your capability and your training, but to envision all new services that you currently aren't trained to do and frankly have not yet to be invented. And frankly, redefining the profession as a longevity profession, not just occupational therapy on its own. So embrace those technologies, whether it's teletherapy or frankly, taking it the next step. I'm not just talking about getting to rural areas and places that may be hard to get, but start a global footprint. Really, the United States is the only industrialized country that is still growing. Do you know that? If you think about this, the population in the US will be 400 million in 2050. The population in China for people over 65 will be 400 million. You've got a contribution to make here at home, but abroad as well. And then lastly, develop new capacities and approaches. Be the trusted provider of that proactive vitality and redefine services to support specific functional benefits. Because frankly, like financial services, you try to get people to plan for their retirement, they don't pay attention. Get them to plan to be able to stay in their house. Get them to plan to be able to stay mobile, stay healthy, to care for a grandchild, or to work. Now you've got my attention. Let me conclude with a wish, or frankly, a challenge to you. I was listening to the radio some months ago, and an architect was being interviewed about skyscrapers. And he said that skyscrapers being built were statements of optimism. Another analog was being used about cathedrals in Europe. You know, these things were built not because they had that many people to go to church, but it was because the architects, the engineers, the mathematicians, and the like wanted to see how far could they push their skill, their craft. Ladies and gentlemen, I think I am looking at the people that can build the skyscraper to redefine aging as proactive vitality and living a better life tomorrow. Build a skyscraper for all of us. Thank you very, very much.
Fantastic.